Hello friends, this is Garima Kuswa, second year professional medical student at GMCH Bettiah, and in this video I would be teaching you people about autocoids, prostaglandins and leukotrienes. Okay, so let's get started with the video. What are autocoids? Firstly, what are autocoids? Substances produced by cells that acts locally. Where they act locally at the site of production. They act locally at the site of production, and what we call them as autocoids. Based on the chemical structure, three types of autocoids are there. What are they? They can be amines, they can be peptide, or they can be lipids. Okay. So examples of amines are histamine, serotonin, and what are peptides which acts as autocoids are angiotensin and bradykinin. And lipids, prostaglandins, leukotrienes and thromboxanes. And I will be asking what are eicosanoids. So you will define it as autocoids like prostaglandins, thromboxanes and leukotrienes derives from arachidonic acids are called eicosanoids, and they ask these questions in your vivas. Okay. So COX, cyclooxygenase enzymes, are of two types, COX-1 and COX-2. COX-1 is constitutive, means it is always present, found in most cells. It's also called housekeeping enzyme, responsible for normal function of prostaglandins like gastric protection against ulcer. COX-1 is constitutive or housekeeping, you can say, because it's always present, always be there for you, responsible for normal function of prostaglandins like gastric protection against ulcers. Okay. And what is the function of COX-2 and what it is about? It's a inducible enzyme, that is, it's not present always, it can be induced, increases at inflammatory sites and responsible for inflammation and neoplasia. What it is responsible for? It's responsible for inflammation and neoplasia. Also present in kidneys, brain and endothelium. Okay. Now what I am going to tell you is about blood vessels. Here you can see it's a blood vessel made up of phospholipid. Phospholipase A2 works on it and converts it into arachidonic acid. But corticosteroids are the thing which inhibits phospholipase A2 and prevents the formation of arachidonic acids and other products which are formed from arachidonic acids like prostaglandins, thromboxane A2, leukotrienes. Okay. So here is the pathway. Here you can see. Let me turn it for you. 1 minute. So this here you can see, like this is the blood vessel, and phospholipase A2 works on the phospholipid and converts it into arachidonic acid, and arachidonic acid is converted into prostaglandins in presence of COX-1 and COX-2. Okay. Prostaglandins and thromboxane A2 are formed from arachidonic acid in presence of COX-1 and COX-2, and leukotriene A4, leukotriene B4, LT, C4, LTD4 and LTE4 are formed in presence of LOX. Okay. And what are the types of prostaglandins? They are prostaglandin E2, prostaglandin F2 alpha, PGI2, PGE2, PGD2, PGF2 alpha. Okay. What are the function of thromboxane A2? Thromboxane A2 helps in aggregation of platelets. Platelets aggregation, thromboxane A2's normal function. And what are the functions of leukotrienes? They do bronchoconstriction in the alveoli or lungs. Okay, lungs. What we will do is we will block all these, we will block phospholipase A2 by using corticosteroids. We will block COX by using aspirin, which blocks it irreversibly. What? Irreversibly. And other NSAIDs like ibuprofen blocks it reversibly. Okay, here you can see. What are the function of prostaglandin? They cause fever, pain and inflammation, and when we block them they can't do those things. So what actions we get? We get antipyretic effect, anti-inflammatory effects and analgesic effect by inhibiting COX enzyme. using aspirin or paracetamol or ibuprofen. Okay. So prostaglandin I2 inhibits. Prostaglandin I2 or prostacyclin is the other name of the PGI2. What it does, it inhibits aggregation of platelets. But here what we are seeing that thromboxane A2 helps in the aggregation of platelets. Now LTB4's function. LTB4 helps in the chemotaxis and inflammation. We use montelukast and jafilukast in case of bronchial asthma and COPD patients. For the prophylaxis of bronchial asthma, what we use is montelukast and jafilukast. Okay. So this table is very important. If you want to copy it, you can copy it from right here. Now, I would be talking about prostaglandin analogs like PGE1 analog, misoprostol, uses it acts as gastroprotective agent and also used for abortion along with mifepristone. Maintain the patency of ductus arteriosus. They ask you this question. What it does? It maintains the patency of ductus arteriosus. Okay. Now the function of alprostadil maintains. It also maintains the patency of ductus arteriosus and helps in treatment of erectile dysfunction. Okay. Now PGE2 analogs, dinoprostone used for cervical ripening. Dinoprostone used for cervical ripening and also used for abortion. Okay. Now PGI2 or prostacyclin. What's the other name? Prostacyclin or PGI2. Epoprostenol, ileprostenil used for pulmonary hypertension. What? Pulmonary hypertension. Now PGF2 alpha analog like carboprost, latanoprost and bimaroprost. Latanoprost, bimaroprost. Carboprost's function is used for abortion and treatment of postpartum hemorrhage. Postpartum hemorrhage we use carboprost. And latanoprost and bimaroprost are used for treatment of open angle glaucoma. What? Open angle glaucoma. How they do so? Why we use them? Because they increases the uveoscleral outflow. They increases the uveoscleral outflow. Latanoprost is the drug of choice for open angle glaucoma. Latanoprost is the drug of choice. Bimatoprost and latanoprost. Side effect of bimatoprost and latanoprost are iris pigmentation, which is also called heterochromia iridis, eyelash overgrowth, hypertrichosis and heterochromia iridis you have to learn. Now we will be talking about leukotrienes. Leukotrienes actions can be inhibited by what? Leukotrienes can be inhibited by corticosteroids by inhibition of phospholipase A2. I told you in that table. Phospholipase A2 inhibition and LOX inhibition by xylitol. Okay. Leukotriene receptor antagonists like jafilukast and montelukast used for bronchial asthma prophylaxis. Okay. Jafilukast and montelukast. And please learn this table, and if you want a PDF or the pages, I will provide it in my Telegram group. You can join it from the below link. So this is all about autocoids, prostaglandins and leukotrienes. I hope you like the session. Do like, subscribe to my channel. All the very best.